Awesome. Good afternoon, good morning, good evening. Thank you to all of you joining from around the world for the restart of the Rhapsody webinars. We're excited to have with us today the Fairfax County Health Department team to talk about their breakthrough with using Rhapsody Envoy in their journey to smarter, scalable integration. Before we kick off, I will cover just a few housekeeping items, and then I'll turn it over to the team for introductions. All right, so this is a live recorded webinar. As someone who registered, whether you're with us here live or whether your colleagues who couldn't join live aren't here but registered, you will get a copy of it. So we will email all registrants, those who've attended and those who couldn't make it today, link to the recording. You are on mute, but we are here for live audience interaction and Q&A. So if you have any questions or comments, feel free to send them through in the questions panel, and we'll raise those throughout the webinar if the questions come in, or we'll hold time at the end as well for additional interaction. My name is Shelly Waymeyer, and I lead go-to-market activation at Rhapsody. I come from a background in EHR implementation, product management, international new market entry, and product marketing. And I'm joined today by the esteemed team at Fairfax County. I'll hand it over to you, Alita, to start to introduce yourself. And when you're done, please pass it on.
Thank you. Hi, everybody. My name is Alita Lange. I'm the Public Health Data Manager at the Fairfax County Health Department Informatics and IT Division. And my responsibilities are the creation and operation of our health data lake. We're emphasizing security, we're emphasizing interoperability. We want to make sure our data is stored correctly, is available for all of our staff members, for them to be able to do all of their work efficiently and effectively. And our data lake right now comprises several databases, storage, pipelines, and machine learning. Thank you for this opportunity, and I'll pass it on to Jim.
Good afternoon, everybody. My name is Jim Borda, and I'm the Public Health Informatics and IT Manager here at the Fairfax Department of Health. So at Fairfax County Department of Health, we do a lot of great work. I've been here about a year, and I'm excited to be with all of you to share the great stuff that we've been doing here with Rhapsody. I come from a background of health IT, and working on interoperability here is my passion, so I'm looking forward to sharing all that we've done here at the Fairfax County Health Department. So thank you very much. Look forward to the conversation. I'll turn it over to Noel.
Yeah, hi everyone. So Noel Claren, I'm the Informatics IT Director here for Fairfax County. So my great team here, as well as many others in the background, we serve and work on a lot of the technical implementation for our agency, a lot of the project management, business processes, a lot of the data management, as well as the technical strategy. So we support specifically our health department and our subject matter experts in all the systems, but then we do have that dotted line in partnership to our enterprise IT group as well. So happy to be here and share some of our journey. Thanks.
Awesome. Thank you all. Impressive backgrounds and impressive work you do. I'd love to give a chance for you to introduce more about what Fairfax County Health District is up to, you know, the scale, autonomy, and the mission of your organization. Jim, would you like to do that?
I would be happy to. Thank you very much, Shelley. Well, our agency is one of the largest health departments in the country, and we are the largest health district within the Virginia Department of Health. We're located in Northern Virginia, right outside of our nation's capital. We are a nationally accredited agency, accredited by the PHAB, and we are also one of 3 health districts in the Virginia Department of Health that is locally governed and administered. With over a staff of 800 in the health department and also 25 plus staff here in our division, we support over 1.2 million residents in our counties. And we are serving those residents on a daily basis, and we're also supporting over 10 divisions across the agency. So we've been doing a lot of great work over the last few years, and our division has been working on a data modernization initiative and journey. We've been focusing on making our data timely, accurate, and actionable. And whether it's supporting disease registries or enabling real-time or near real-time reporting, helping our clinicians and other community partners respond to emerging health threats, we are focused and dedicated on advancing our mission. And at the heart of this mission is interoperability. We are connecting our systems and providers and public health in a way that ensures that the information is right, it's delivered on time, and that way our providers and clinicians and all of our constituents will benefit from that. So today we're really excited to be here to share how we're working with Rhapsody in order to advance our mission and to bring the real impact and better outcomes to the communities that we serve. So I'll go ahead and turn it back over to you, Shelley.
Awesome, thank you. Yeah, it's incredible scope of, I think, what you do with such a lean team. Well, so with that being said, what initially prompted your team to explore a new integration and data exchange strategy?
Sure, so I could take that one. You know, COVID happened, right? The pandemic. We were a much smaller team back then, so a team of about 5. And so we had some systems in place. We were working through an EHR integration. We were contemplating and working through a data strategy with a data warehouse at the time, and then obviously supporting a lot of the pandemic emergency related tools. During that time, obviously there's other enhancements or modernization efforts that our enterprise IT is doing, right? Security updates, server updates, all of that. And unfortunately, we got that call where Central IT was saying, hey, we need to upgrade a server. And it was on Windows 2012, imagine. There were some security updates with TSL, and we just broke our current integration engine or the old on-prem sort of system with Rhapsody. So that really triggered it. That caused us to look at like, wow, should we really rely on our on-prem system? Should we, you know, what resources do we have? And then we really, from there, we started exploring the different opportunities sort of with that cloud mindset first, as well as sort of, you know, from a resourcing standpoint, how do we ensure we can maintain this and don't run into an error or a downtime like we sort of did during the pandemic and during our efforts.
Yeah, that makes sense. That makes sense. What were you looking into from a cloud readiness perspective, or what did your cloud environment look like at that time?
We were just starting, to be honest, and you know, I'll let Alita add, but I think at the time a lot of our systems were on-prem, or realistically in public health, we were still on paper for a number of things. So while we were looking at sort of different integration tools or ways we could utilize some of those services, we were still working on other efforts like our EHR modernization, disease surveillance, just better data management. So we were exploring a number of different things. Locally here in Fairfax, we are sort of a Microsoft team. A lot of our tools and stuff are built onto that. So we started first with assessment of Microsoft and Azure and looking at how do we move some other things from on-prem to sort of the Azure cloud environment. Alita, did I miss anything there?
Yeah, I was just going to add that, you know, as Noel mentioned, that this was during COVID. So we were also supporting all of the technological needs for the COVID response. And so with the server going down, knowing that we needed to still send our lab reports, knowing that the health record was coming and we needed an interface to move the, you know, the orders from the health records to the lab and back and the results back. Noel's vision was just really, you know, he was looking ahead 5 years and he was looking at our team. And I just remember the day that he said, hey, have you seen the, you know, Rhapsody actually has this managed service, and with everything that we have going on, it just seemed to fit exactly where he wanted to take our department on the technology side. So we were already looking at Azure Cloud for our platform, for our data warehouse, Lake now. And so it just seemed to fit really well in the vision and the strategic plan.
Yeah, that makes sense. So to play that back, you're an existing Rhapsody customer, you're using Rhapsody integration hosted on your own infrastructure. You've got some infrastructure that needs renewed, so it brings you a decision point. Do we continue with this on-prem strategy? Do we look at what options Azure has, you know, to kind of build your own way towards it? Or do you see if Envoy's an option. Is that right?
Yeah, no, that's definitely right. And I mean, I think we just have to admit that we were a Rhapsody customer, but we probably weren't the best in a sense of we had implemented a decade ago or even longer, I think. So this was prior to any three of us being on the health department team, and we hadn't modernized since. So it was really a chance to relook at the direction we were going from what currently we were doing through Rhapsody, but also where we were going to go when you think about just overall public health interoperability.
Yeah, that makes sense. And so we started to get, towards this talking point already, but, why did you ultimately choose the Envoy iPaaS solution? And is there anything that stood out in the process as you were weighing those three options?
Yeah, I'll take this one first. But, I think when we were evaluating things, as we mentioned, we were a smaller team at that time, and we were very lean. And we had a lot of growing sort of responsibilities across the entire agency. So we were increasing that sort of portfolio per se. And so when we were exploring what our different options are, thinking of where we wanted to go with data exchange and data use within our agency, we were evaluating Rhapsody and other tools from a investment perspective per se, right? Our central IT partners have responsibilities with our infrastructure around, say, security, servers, et cetera. We have responsibilities from the health department side of understanding how our data needs to move, how do we protect it, and all that. And we had to make some decisions on what made the most sense for our team to truly focus on, right? Do I want to take the limited resources that we have and utilize that on just integration exchange sort of resources or responsibilities, or does it make sense for us to find a partner like Rhapsody, utilize a managed type of service, and so we can then refocus on taking the data into our data warehouse and actually using it or working with our programs to use that data for public health decision making. So it really was a sort of a resource decision and sort of a focus. And at that time, it was, we needed to do things with the data. We needed to support our programs, and we couldn't just be hiding behind the scenes and just doing data processing or integration services. So that's sort of where it stood out, or what stood out for us to make that decision. I think as we chose the product and went through implementation, I'll sort of pass it to Alita, and she can kind of talk through some pieces there.
As far as the implementation of Envoy, it was just extremely smooth. Once we got through the legal items that Noelle had to go through and sign off of and all of that, it was just really smooth for us to onboard with Envoy. One of the first things our architect and the project manager was we listed out all the things we're currently using or were using with Rhapsody, what was coming down the pipeline that we wanted to use interfaces for, and then what projects were coming. And so the first part obviously was the infrastructure and the network security and connecting with Rhapsody. Our lab is on its own separate, network just because of the type of information they have. And all of it was Fairfax, but just, different ways to connect. And Envoy brought on their network folks. They brought all the right people to the meeting, helped our enterprise IT. Envoy's done this many, many times. So they knew what needs to get done in what order. And so they were able to provide all of that to our enterprise. And it was just seamless to get that secure connection between Envoy and the health department. And then we started off with the main interface that broke, and that was actually our electronic lab reporting to the state. And we'll get into this a little bit more as the webinar goes through, but we actually started with a script from our lab information system nightly to send all of our required reportables to the state. And so that's where Envoy started. And at that same time, we were implementing our electronic health record too. And it was so great because Rhapsody came to those meetings of, creating the HL7 messaging and the connections with our electronic health record vendor too. So it was really great. And again, it was the vision that we always had Rhapsody as our integration engine, because you never know when we're going to change systems. In the future, you never know what's going to happen. And that way we always already had an established messaging and data set that was ready no matter how we changed our systems. Let's see, testing, always doing test messages. They're always available when we need them. And then go live when we took the EHR live to production. You know, it was literally you send an email and there's a reply on this is not working, or you know, did this go through? Can you tell us how many went? If there was any question on it. So it was just, the implementation was just really seamless for us.
Nice. And you started right first with that. It was the EHR LIS integration for reporting, and then after that,
Yes.
did you run kind of concurrently until everything was migrated, or how did that play out?
Yes, so we kept everything concurrent. So we started off with our nightly messaging to the state for our required lab results. Then we went to the integration between our electronic health record and our lab information system for ordering and results. And then we moved to interface directly from our lab information system. So now we weren't running a nightly script. As soon as a lab's resulted, it onboards straight to our state. And Rhapsody was a big part of that too, because to change the way we were sending data to the state, we had to go through an extensive validation process. And Rhapsody was there with us the entire time. Every question that came back, whether our system, you know, may not be able to transform the result the way the state wanted it, Rhapsody did all of that for us. And so it's been great. If you know, anything goes down, Rhapsody calls us, lets us know. We've had minimal technology, you know, issues reporting to the state. We were able to go live with our ELR with the state within 6 months. It takes most jurisdictions a year. And so we do give a lot of credit to Envoy for, you know, making that process so much smoother for us. And then from there, we had other implementation, interoperability projects that we used Envoy for.
Awesome. Yeah, I'd love to hear that. 50% faster onboarding to that ELR program. What was it like deciding whether you were rebuilding or retrofitting interfaces? Was it an opportunity to see if they were built as you wanted, or did you move them over like for like?
We started one like for like just because of timing and rules and regulations that we have to, you know, report at a certain time. But the other part of it too is Rhapsody keeps up with all the, you know, with all the versions and all the new standards that are coming up. So we may not have been aware of something, and they would just ping us and be like, hey, there's been a change to this rule, and they would help us with that. And so I would say only that first one, just because of the requirement to report, was like for like, but then that's now been replaced with a lab information system directly to our state. Electronic lab reporting. Nice.
What was it like to lose that direct control, going from managing your own integration?
It was great. You've got to remember, like, we were in the middle, you know, we were 5 people. I think maybe we went up to 7. We were in the middle of the COVID response. It was so great to know someone else was taking care of security updates. If something went down, it was just an email or a phone call. And that took us off our plate because our director thought it was great to implement electronic health record during COVID too. So we just had a lot on our plate. We were starting our data. We started small with a cloud data warehouse, and then we moved to the lake. So we had so much going on at once that it was just so helpful to hand it off to someone else.
Awesome. I love that I couldn't even get my question out. You're like, it was great. It was great. Oh, awesome. And so we already heard one improvement that you've seen since you made the switch to focusing on data strategy over the nuts and bolts of the data exchange. And that was getting that ELR program live in 6 months versus what was expected to be about a year. Are there any other outcomes or improvements that you've seen with this change in strategy?
It's been great. I mean, Noelle, do you want to talk about our pilot programs, or do you want me to start, or I'll just jump in when you're done?
Yeah, no, I can certainly touch on it. I mean, as we talked, like we were working on a number of different sort of public health modernization efforts as we were standing up our data warehouse and having discussions with our different programs. Like we were getting a better understanding of like the different data sources that they needed access to, right? And so while we only had lab reports at the time, and then we increased the EHR, our growing list of like changes or systems or data sets that we needed to the agency tripled or quadrupled at the same time. And so we started working concurrently as we were doing some of these other things on some pilot efforts. So we were fortunate enough to work on a pilot to demonstrate the abilities of local to state public health data exchange utilizing FHIR. FHIR was new to us. It was sort of a new endeavor for our state partners as well. And there weren't really very many examples from a state to local public health jurisdiction of how that was working. And so we started implementing some of that. So we started small per se, I guess, where there are already FHIR IG guides out for death records. Others were sort of involved in this project as well, like other example jurisdictions, but we worked with our state to get bulk FHIR death records to us. Previously, that was done, I think, quarterly, or even monthly. And that's if it was remembered, if the data was available to us, and then the pilot and the project allowed us to go to nightly loads of death records from our state down to us at a local jurisdiction to our data lake. And then the success of that sort of led into another FHIR pilot that we utilized our Envoy sort of services for birth. And we started doing the same thing. Started utilizing the FHIR IG guides, working with the Rhapsody developers and our state partners, and went through that project as well. So now we are live on FHIR integration with the state for 2 different vital records sets. And I think, where that's helped us, like I said earlier, like it helped us refocus. What we want or need to do with the data is important. Our role is to support our constituents in our community. And instead of being in the background and working on the data and making sure it connects from one system to the other and it's secure, we're allowing or have the benefit of the Rhapsody service. And then our team, so Alita's data team, and along with our other project leads, are able to focus with our divisions and our programs to say, what are we going to do with this data? How does it affect your division, your business processes, and how do we improve that? And then we can actually support sort of our public health outcome measures through all of it all. So I mean, I think that's been the benefit that we've seen. I don't know, Alita, you can certainly add more.
I just kind of wanted to add like real life things. So when we started with the FHIR implementation, again, we'd never done it. Rhapsody, was the one who took all of the load off of us for that. But when we started with the death records, as Noel said, were supposed to be monthly. Sometimes people forgot, and it came through SFTP. And so we had to have 1 or 2 epidemiologists log in to access the file, download the file, put it in a shared drive, that obviously was secured, in certain folders. We've got security levels on those folders, but it just sat there. And then the people who had access to it, everyone would make a copy of their death records and transform it or manipulate it in the way they needed. And so we didn't have this like single source of truth, right? You didn't know who was using which copy. And the amazing part about Envoy, not just did we prove that FHIR gives us an advantage as far as the interoperability and transferring data and the security of that, but it's also now we get it nightly. And if we don't get it nightly, it's Envoy who contacts the state and says, hey, we polled you today and we didn't get any messages for death. And they're like, oh, thanks, let us look and, fix what they want. So there's so much more advantages and just time saving for all of us. And now the death records, sit in the data warehouse in a, secure environment. Access is restricted to who needs it, but all the transformations are now done in the data warehouse. So everyone has the same data transformed. And it's the source of truth for them to use and support the work that they're doing in the county.
Nice.
Yep.
Yeah, I love that use case, and I love what you said, Noel, is just like your role is to serve the constituents, and now you have more time to really work on the programs that serve the constituents with the divisions, you know, responsible for them. So you can really level up from focusing on just connecting the data and getting it where it needs to be to like what's being done with the data to serve the people. That's awesome. We hear that similar type story too from some of our customers in other segments, but it's the same. It's like the same thing in terms of focusing on what you do best, right? Focusing on what you really the mission of the organization is, leveling up to that, whatever it is. So, certainly makes my job more fun when we can enable you to be the best at what you do.
Yeah, and I think that's what's important for us as our sort of what we call our IT informatics team, in a sense of like we see ourselves as an enabler to our programs. Like we're here to help resolve issues or problems, and sometimes when we're too focused on the technical aspects of it, you know, that can be a challenge. And so that has been something that Jim and I have been sort of working with and defining sort of as a long-term roadmap for us is where is our true responsibility for our programs and our divisions? What are the roles that we should serve? What are the roles that our enterprise IT partners should serve? And then where does it make sense to build sort of those private-public partnerships so that way we can work a lot more efficiently and get work done, especially in this public health environment.
Yeah, that's great. I had a note here, and I don't remember the anecdote, but when we were in prep, you said something about the weekend support response and just how much that's alleviated, you know, that reality of overtime and being on call in roles like ours often are.
Yeah, I mean, you know, when we were first evaluating Rhapsody and Envoy and some of the other solutions, right? Like working with our enterprise, like those are other things you have to think about, like a security lens, what is our disaster recovery plan, what's our backup plan, all of that kind of stuff. And so as we relooked at like our cloud strategy, you know, where does that make sense? Are we even resourced enough to fulfill a 24/7 role? And so that was also part of that decision. You know, reality is no, we didn't have enough staff at the time, and still don't, to be a 24/7 type of shop. And so where does it make the most sense to find those sort of managed service partnerships that could help fulfill those, and then we can shift and be available during the appropriate time bands for our programs. You know, it's not a responsibility I would say I want to completely take on. If we have to, we will, right? But where is that focus? Should we, or is the value being with our divisions, working with them on their systems and their enhancements, so that way they could use it better?
Yeah, that's a great point. I feel like you had like a really strong vision to make a strategic move when the opportunity presented itself, and yeah, that's admirable to be that forward thinking and make the best use of what you've got. Have just a couple more questions prepped, and then we're happy to take any questions from the audience. If you have any questions, please pop them in the questions panel and we can field them for the team. One of the last ones I had prepared is, what advice would you give to organizations that are hesitant about cloud-based integration or hesitant to let go of some of that control?
Yeah, I'll be happy to take that, Shelley. Well, I think it's important to think about the long-term journey, and it's something that is important. You have to look at the long-term value. It's going to be maybe a little challenging up front, but our suggestion and recommendation, I think we mentioned it earlier, is to start small. Look at these pilots and, you know, take those baby steps with pilot programs so you learn along the way. But the thing that I really want to emphasize is how much of a value Rhapsody is in those steps that you're taking as you're going forward. So don't think of it in terms of an initial burden or too much of a cost, because you will get that back in the long term, as I said, with the value that will be gained, the efficiencies that you're going to be gaining through the integration and the support and services that Rhapsody will provide along the way. You just can't go wrong. So this type of service, managed services, integrated services, and the fact that you are the experts in terms of helping to transfer data from one point to the other through the interoperability efforts that we're talking about, you can't go wrong. So the question really is how much longer are you going to wait before you go on board and start taking advantage of the opportunities that are presented by these services and tools that you provide. So having worked closely here with Alita and Noel over the last several months, it's given me the opportunity to really be able to create that path forward in terms of doing more with less, because you as an organization can provide us those tools and resources that we need on the back end, and most importantly, help us move forward with those ideas that we have in terms of providing better services sooner, faster, rather than later. But again, it is a journey, and so anyone considering the integrated services and being able to look at doing things better with your services will not go wrong in terms of starting small with pilot programs and then learning along the way and taking full advantage of all the services that you offer. So that is basically what you should be looking at in terms of, if there's any doubt, you really have to just look at it in terms of that added value and all of the efficiencies you're going to gain downstream. But thank you so much for the question.
Yeah, awesome. Thank you, Jim.
Yeah.
Yeah, it's kind of that buzzword, but it's true. It's like when you can kind of level up from that day-to-day grind and really think about what's going to provide the most impact. Yeah, it can become more obvious. Let's see, last question I had here, and then we do have about 2 or 3 in the chat I can bring forward. How do you see your integration and data strategy evolving going forward? I know we talked about your work on this Fire CDC pilot. We also talked about, I think at one point you talked about some additional bulk data loads into your data lake and a new disease surveillance platform. Are any of those good ones to touch on now?
Yeah, I mean, all of them. I think, as we continue to go through our public health data modernization journey, there's a number of different projects that we've been working on. We just moved our lab system to the cloud, and working through how do we integrate more of that data into our data lake. And so is that gonna, we'll be evaluating how will or should Rhapsody help with sort of that integration process. But there's other efforts that we're working on in partnership with our state and following sort of the larger CDC data modernization strategies, right? So there's obviously a big push on other fire IGs being implemented, and the use of more data to our EPIs and our clinical programs will continue to increase. So we have been working with our state partners on cancer registry and how does that look, getting that data back down to the local level. So sort of thinking through how we would expand those efforts. There have been other discussions around chronic disease in general. And so how can we help do surveillance for chronic disease with our population health teams, and what data sets would they need from our states or other available sources? So we'll be sort of combing through some of those over the next coming months, trying to figure out what is the right timeline, before I throw everything at the wall at the team and say, hey, let's do it all at once. I think the other thing that we continue to explore as a team, we are a TEFCA early adopter, so the Trusted Exchange Framework Common Agreement, and trying to improve some of that other public health interoperability. And so while we are or have been working with our HIE and other partners on sort of a portal, how do we get that portal integrated into some of our systems? And so looking at our data lake, our integration services, that has sort of been a key item as part of that. How do we just connect, that data set, and then it can to our data lake, and then from there we can have access to other TEFCA query needs, etc. So a number of different projects. Right now it's sort of just bouncing off of what makes the most sense, where do we have the right buy-in and stakeholders engaged with us, and sort of how can we best utilize the funding and staff that we have at hand. I don't know, Jim, Alita, anything else to add?
No, I think you covered it, Noel. I think we're just excited to continue the journey with Rhapsody. There's a lot of work, a lot of opportunities, but the continued effort here just continues to get stronger and stronger. And so we're excited and have a lot of things that I think we'll be able to accomplish in the near term. So thank you.
Awesome. Great to hear. All right. So hot off the press, we have one question from the audience. Does your team access the Rhapsody system for any troubleshooting, build, configurations, all ad lib here, monitoring, or are you completely hands-off?
Completely hands-off, but we're notified all the time, even on weekends, if there's an issue. Usually the notification is, hey, there was an issue and we already fixed it. So it's we're completely hands-off, but I will say that Rhapsody does provide, there's some courses and some certifications you can take. So we, at least we've done the course, we understand how Rhapsody works and we understand how the interfaces work. And so that was extremely helpful too for, when you get the troubleshooting, you kind of already understand what happened and how the fix was done.
Yeah, and I would just add that I think that's just part of our scope of work with Rhapsody, right? So we have the full Envoy sort of cloud-hosted Rhapsody, but also the managed service that manages our integrations. We were just looking at the cloud-hosted Rhapsody where we would have to monitor and be in it more, but based on sort of decisions and resources and stuff, we went for the full cloud-hosted plus managed sort of support.
Yeah, awesome, thank you. I was about to offer the same, that we have different levels based on the needs. Some of our Envoy customers want more visibility into their own monitoring, and so there's different levels there. Another question we got was, and you're hands off at this point, so this is probably one we can handle in a follow-up to you who asked, but when dealing with multiple standards like HL7 V2, FHIR, DICOM, what are some of the best practices, or how does that work out to transform those messages in Rhapsody? I know from your use cases, you're using right now, it sounds like heavily HL7 V2, SFTP, and you've introduced FHIR with the CDC pilot. And what's the experience been in getting the output of what you need from Rhapsody there?
Yeah, the experience has been great. In some of our interfaces, the HL7 has already been created on our end. Again, version 2, most cases our data does go to Rhapsody. Rhapsody creates the HL7 messages and the responses and all of that. So they take care of all of those issues for us, and on the FHIR side too.
Awesome. And since they mentioned DICOM, I'll have to plug, we did just release a new image directory solution that can be delivered via Envoy, and it's DICOM routing. So we can move images and handle basic DICOM routing and EMPI from that extension of the suite. Someone asked if we can send more information about what else Rhapsody offers and how the data mapping works, and we can follow up afterwards with you for that. Any other questions? I'll ask my organizers. All right, it doesn't look like any others are coming through. Jim, Alita, Noelle, I really enjoyed this prep for the webinar with you. I learned so much, and I think we really justified all your hard work. Did all your hard work justice on our call today. Is there anything else you'd want to add?
No, I think it was all covered. I appreciate your support, Shelley, and hopefully this information helps those out there that are exploring or and whatnot. But happy to answer any other questions offline if they come to you all.
Awesome. Well, I appreciate that, and we'll stay in touch to be sure to track how things are going for you. And with that, we'll bring the webinar to a close.
Thanks, everyone.
Thank you.